Good morning, everybody. I'm Vic Markowski. Like Kate said, I am the Drug Intelligence Officer for Chicago HIDTA. I've been in position almost 7 years now. Hard to imagine it goes by that fast. Kate, you just want to start running the slide?
Yes. Are you all seeing the slides right now? The federal acknowledgement should be up on the screen. Have we seen that?
I haven't.
Yes, Kate.
Yep. Yeah.
Okay, great.
Okay, so what we're going to talk about today is we're going to do an introduction of the overdose response strategy, which is a program DJ, Kate, and myself work under. We're going to talk a little bit about the ODMAP implementation and status we have here in Illinois, along with some updates and social determinants. And then we're going to spin it a little bit as to how you're going to be able to use ODMAP to help out your OFRs that you either have currently running in your organizations or that you're looking to get going. And then finally touch on the expansion of evidence-based interventions and some upcoming training that Kate and I have been working on for the past few months that's coming up within 30 days. For those who are not familiar with the HIDTA program, HIDTA stands for High Intensity Drug Trafficking Area. HIDTA is a program under the Office of National Drug Control Policy under the White House. Two counter programs. You have HIDTA and you also have drug-free communities. There are currently 33 HIDTAs operating within the country, covering all 50 states along with Washington, D.C. and the U.S. Virgin Islands and Puerto Rico. HIDTAs always have what we call HIDTA designated counties. In Illinois, as this map shows, the counties colored in green are the counties that the Chicago HIDTA covers, which is Lake, Cook, DuPage, Will, Kendall, Grundy, and effective September 1, Kankakee County. Now, the great thing for us is that if we can go back for just a second. Thank you. Great thing for us in Chicago HIDTA is these 7 counties cover approximately 68% of the population of all of Illinois. You'll notice on our western border, we have 3 counties colored in blue: Rock Island County, Madison, and St. Clair County. Those counties also have HIDTA designation. However, those are covered by the Midwest HIDTA because Rock Island County is in partnership with Scott County in Iowa. And then down in Madison and St. Clair County, those would be with the Midwest HIDTA out of Missouri as well, because those counties would prosecute out of the federal courthouse system down in St. Louis. So 102 counties, those are our HIDTA designated counties. Next. Take it, Kate.
So the overdose response strategy is a national network that is a partnership of public health and public safety. And we really feel that we are stronger together. In my role as public health analyst, I serve as a trauma-informed link between public health, public safety, and persons with lived and living experience. And as we know, with drug-free communities, local problems require local solutions. So our goal is just to edify the local prevention champions who are truly making a difference, just like yourselves. So how do we do this? We focus on collaboration and just opening doors for any of our partners, being connectors, sharing the latest and greatest data, highlighting trends, and then as we're able to connect, we are able
She looks familiar.
Oh, I think someone's not on mute. To connect what's happening here in your county, and then we can share with our partners on the other side of the country and ask them, okay, this is a trend that we are seeing. How are you responding? What's working in real time? Give us your lessons learned. So it just makes us so much more effective to have these partners all across the United States. We're able to help counties with their grants, as they are always looking for the latest data to include in new partnerships. And then also just to help share and inform counties on evidence-based practices and ways that we can become more effective in prevention. I'll pass it back to Vic to walk us through some of our specific programs that we would like to highlight for you all in case you are interested in helping to bring to your community in addition to overdose fatality reviews, which are so needed.
Great, thank you, Kate. Like Kate pointed out, one of the great benefits of our program is that with it having that national view, we are able to reach out, get ideas, find out what's worked great in areas and what, they wish that they would have maybe done a little bit differently. Some of the programs that we like to propose for adoption here within Illinois are programs, like I said, that have been used nationally. First one we're going to hit on quite a bit in this meeting is ODMAP, which is the Overdose Detection Mapping Application Program. We'll cover that later. A naloxone leave-behind kit. We encourage this for both law enforcement. We encourage this for public health. We encourage this for all first responders. That after an overdose happens, a non-fatal overdose, to leave a dosage of Narcan behind. And we obviously would like to have some kind of programming information to stay with it as well for once somebody is actually ready to get into treatment, they have a guide and perhaps a warm handoff when needed. Next one is naloxone vending machines. We're seeing a marked decrease in fatal overdoses both in Illinois and across the country, and there's multiple reasons as to why. One of them, I believe, is because we're getting more naloxone, more Narcan into the lay people's hands. And so one of the ways to do this is through a naloxone vending machine. I kind of like to break it down a little bit further on why make it a vending machine, just make it any kind of a distribution point. Vending machines are prone to break down and costly repairs. A post-overdose outreach, again, after somebody survives a non-fatal overdose, within a few days, perhaps public safety, definitely with public health, goes back out and visits the victim of that overdose. Supplies information when available, let them know what opportunities are available for them when they're ready to get treatment. The deflection diversion programming, that's primarily for law enforcement. I think I heard somebody from the southern tip of Illinois. I was down when it's been almost a couple years now, when working with TAS, you got one of your first deflection diversion programs down going up there. And that is when you somebody is contacted by law enforcement with a small amount of narcotic. It's not a trafficking charge. There's no other underlying charges available. You know, to do a scoring criteria with that person on intake form and find out, is court and jail the best place for that person to go, or perhaps are they ready to enter into a treatment option? Obviously, the ultimate goal would be to get somebody to be able to address their addiction or substance use disorder, and obviously a great way for us to eliminate the number of overdose that were occurring. Overdose fatal review panel, a lot of you know a heck of a lot more about that than I do, but this is something that we are strongly engaged with. I believe the first one that was ever up and going was in Kendall County with the coroner, Jackie Purcell there. And our team in Chicago was with her step by step at the very beginning of it to get it going. And then finally, a program, Handle with Care. For those of you who are not familiar with it, Handle with Care is when law enforcement and first responders partner with the school districts, especially the elementary level. And if there's a traumatic event that occurs at the residence, whether it be a battery, a domestic violence situation, a death investigation, or perhaps even a search warrant where there's significant engagement by law enforcement, we go ahead and we reach out to the schools and let the school know. And it can just be as simple as, hey, Riverview Elementary School, your student, Victor Markowski, Handle with Care. And then that way, if they notice a student is perhaps withdrawn that day, not being themselves, or perhaps aggressively acting out, rather than just thinking that the student is, you know, in a bad mood or whatever, it's a great opportunity for intervention with social workers and people within the school. So the line that Kate and I put down there is, we present these programmings to our partners. They decide what programs they like out of them, and we support. And we always encourage the stakeholders to take the program, the ideas that we are able to present, and to make it their own and make it exactly fit the areas that they're working in. Next.
So we are encouraged to see that we are seeing a decline, which is not what we're usually known for in Illinois with substance use disorder. So Illinois, all drug and opioid overdose related emergency department visits is seeing a decline. So we're really encouraged to see this. As Vic said, there's so many different things this could be attributed to. Like he said, naloxone saturation, people starting to avoid using alone, more systems of care becoming more trauma informed, so many pieces of the puzzle. But we just want to thank you all for all that you are doing to help advance this. We see that at the national level as well, we're starting to see this decline, which is also encouraging. So again, prevention champions matter. We all need to play our part, anything we can do to help continue this decline. Vic's going to tell us about Narcan and the importance of access and ways to get it for free.
Absolutely. So in Illinois, anybody who's within one of the organizations can enroll as a DOP or drug overdose prevention program. Kudos to Scott and your team out there in DuPage County. And Mila, Kate and I presented at the DuPage County Chiefs meeting on Thursday up in Addison, Illinois. We put the slide up and had great engagement from all the chiefs and primary law enforcement officials that, you know what, we're good. DuPage County Public Health did a great job of getting us a Narcan, the naloxone that we need. But for anybody who does not have that available, if you scan this QR code or you go to the website on the bottom from DHS and enroll your organization as DOP, you're able to get the Narcan, naloxone that you need for free to go ahead and provide to your first responders, your public health, your community outreach groups, and everything of that nature. Next.
So if you are interested in launching one of these initiatives in your sphere of influence, we would absolutely love to just help be a support for you. As we said already, we are a free program available for free support for you and your community. This is a QR code that I would request you to fill out. It just takes, a minute, and it's just a way for you to say, this is one of these initiatives that I would be interested in learning more about or interested in receiving some support for our community. I'll pass it back to Vic.
All right, Kate, what do you think if we're going to be pretty good on time if we pause for a second and see if any of the guest members that we have any questions about what we've currently covered?
Absolutely.
Before I get too deep.
There is one question from Elizabeth. She wants to know if the numbers that you were just describing about overdose death decline was true just for white populations, or is that also true for communities of color?
That was statewide data. Mm-hmm.
All right, thank you. Any other questions? Go ahead,
It's an
Mila.
important conversation as we're looking at equity. That's why we're really excited to share with you. As we talk about ODMAP, we just launched a social determinants of health overlay to really have these conversations to be as data informed as possible. So thank you for bringing that up.
Mila, you got your hand up?
Yeah, just a quick question about data. The map is a great visual to see, and I think having that overlay is awesome. But you guys all do collect some data, and I think it would be helpful for us and maybe some others to have some of the data that you're collecting, I think, to be able to share it out. Is that something that report-wise we could look for, or is there a way that maybe that might be done?
Absolutely. So my role, I'm embedded in both the Chicago HIDTA and the Illinois Department of Public Health, and we are constantly pushing out the semi-annual report. Leslie Wise does an excellent job with this data, but we're also, always stewarding, any type of data we can get from the CDC, from, the national level, the local level, but this next part of this presentation will be really doing a deep dive into that exact question of how we can really go deep, even at zip code level, to see how we can become more effective in becoming trauma-informed, recovery-oriented, equity-based, but really just preventing as much substance use disorders as possible.
That's exciting to hear. Thank you.
Okay, great. If there's nothing else, I'm sorry, go ahead.
No, I was just going to ask if there's any other questions, otherwise we can move on.
All right, Indira, how about if we get rolling on, and if there's any other questions as we get throughout the end of the ODMAP portion, we can jump back to them.
Sounds good. Go ahead. Thank you.
Rock and roll. Let's get going. All right. So for those of you who are unaware, ODMAP is the Overdose Detection Mapping Application Program. Next. And what is it? The most important thing about ODMAP, besides that it's easy to use, because I figured out how to use it, and it's a free tool. It is designed to provide near real-time activity and surveillance of both fatal and non-fatal overdoses. And the reason why I believe this is so important is the data that we normally get from the CDC and from everybody else just addresses fatal overdoses. And while those are ones that we need to pay a lot of attention to, I believe that today's non-fatal overdose can be tomorrow's fatal overdose. So whatever we can do to get in front of this to save the victims of the non-fatal overdose, again, we're just going to be steps ahead of where we were. So it's built off of an Esri mapping program. And we say it's near real time because the data in ODMAP goes in literally as fast as the user will go ahead and submit the data into ODMAP. I've been working in the program, have my map pulled up with my counters on it, and while I'm in it, I'll turn my head for a second, turn back, and my count of overdoses will change. So it's really that quick. And it's designed to go across jurisdictions. You can search by zip code, by county, by multiple counties, by multiple states. You can even customize your filters and get the exact data that you need. Next. Like I said, such great information in there that you're able to filter. You can filter by fatal overdose, by non-fatal. You can include both. You can filter by drug type. You can filter if you're looking for overdoses related to prescription drugs, if you're looking for overdoses related to stimulants as opposed to an opioid. You can pull charts out of it. Anything that you filter off, you can chart on. A lot of the charts are exportable either in a Excel spreadsheet or a couple other formats. And really the great thing is that you're able to set an alert for a spike, and we'll get into that a little bit more. But DJ's on the call. He'll talk about social determinants later. When you take a look at this map, any county colored in yellow is a county that currently has ODMAP participation. The states that are fully colored in, those are going to be states that have statewide implementation. In Illinois, we're doing pretty good. Next. As of last week, we had 304 agencies within 52 of our 102 counties currently reporting to ODMAP. We've had over now 135,000 overdoses reported since the inception of it. And in 2023, we had 11,400 overdoses reported to ODMAP. Now, is that the number of total overdoses in Illinois? Absolutely not. But what that is from our participants and our users of ODMAP. It's like any other tool. The more users we have coming on board, the better it's going to get. We currently have the bulk of our transmissions coming in from the Chicago Fire Department because this Public Act 101-0320 we got passed in 2019, and that requires all municipalities that operate an EMS system with a population over 1 million to enter their overdoses within 24 hours, either to ODMAP or to a similar mapping type program. Because of that, we work with Chicago Fire Department and got an API or an application programming interface established to allow all of Chicago's overdoses to come into ODMAP. And the way their API works, it's normally about a 2-3 hour lag between when the overdose occurs and the EMS truck provider arrives on scene to when we're actually seeing the data in ODMAP. So that's actually really good. Now, one of the things we're working to do is we are currently working with legislators in Illinois to get the verbiage change in this act to strike out the population over 1 million and a municipally run EMS system. We believe once we get this filing done, and we think we're going to have pretty good support for it, then that will go ahead and open up most of the EMS systems operating within Illinois and most of the fire and ambulance companies to start submitting their overdoses in. And why is that going to help us so much? Next. There we go. The benefit to that robust entry, we currently have that again with Chicago Fire. So Kate and I are able to take a great look at the data that Chicago Fire is entering in. We can see when there's a spike, when there's a large cluster of overdoses happening. And then we are able to reach out to Chicago Department of Public Health. We reach out to the Illinois Department of Public Health. I'll reach out to the police agencies operating up in that area as well, and all the other health services, because we want to make sure that people are aware of an area that a spike in overdose is happening, so we can deploy street resources. We can put public health workers in the area. We can saturate the area with a lock zone. I do notify law enforcement because perhaps they are aware of somebody in the area selling drugs. And so if we're able to get the drugs that are causing the overdose off the street, it's kind of like pulling that knife out of your leg. You know, you stop the pain right away from happening, and then you allow all the other intervention groups we have. So one thing with ODMAP, and the question does come up from time to time, is that we never utilize the information in ODMAP to target users or to start our criminal investigations. We will respond to a spike information, a spike area, just for the fact that if we are able to identify the seller, not the user, not the person with a substance use disorder, we would want to stop the flood of the drug within the area. But ODMAP, both the way we use it and also under its national mandate, cannot be used to initiate criminal investigations. Kate, I'm going to turn this to you and DJ because this is well above my pay grade.
All right. Well, we are thrilled to be able to share that Illinois has now launched our social determinants of health overlay, thanks to help from our Kansas partner, who really did an excellent job of helping us to launch this. So I will allow you to take over the screen sharing and share with us about the social determinants of health overlay, and also how this overdose fatality reviews can really steward ODMAP to help their communication improve to a next level of efficiency in terms of what are the gaps, what are the duplications, how can we be more effective. So thank you, DJ.
No problem. Thank you, Kate. Yeah, so I am the public health analyst in Kansas. I've probably been in my role now for about 3 years. And primarily I work with the GIS software out of Esri. You'll see on your screen, this is Illinois, Chicago area for, I believe I selected 2024 up until the 25th. This is some of the filtering areas that Vic was talking about. But if you're an ODMAP user, you can add layers. So you can see I searched for Chicago Transit, but you can look for any type of applications that may be public record or layers that maybe you've created yourself. If it's more something that you don't want publicly available and you have a GeoJSON file, you can also add that. So that is beneficial for ODMAP for this purpose. So you can see I've already uploaded some of those layers that Kate was talking about just to speed up the process a little bit. But you can add your transit lines and start looking for certain hotspots at different intersections. So you can see, you clicked on a cluster area, you can now see there were 16 events there. Over this area, 26. And so that can give you some insights into where along these transit lines you can put prevention resources or harm reduction resources. I think probably Chicago area is a little bit better about doing that than a lot of other areas are as far as putting naloxone near public transit. You can also look at some gas stations. So here you got a cluster of 3. Here you got 1 point near this. And then you also have a gas station at this point, which would be 17 events there. So you can look around and so this gas station's BP. You can look at the Google Maps Street View, and there's the address for that specific gas station. So we do that for a lot of planning, but it's also good for context and getting a contextual environment of what's going on. Lodging facilities is another one you can add. I don't see as much of a relationship with lodging facilities out of Chicago area as I do in Kansas with Kansas City and Wichita. But, you know, we have motels that only cost $35 a night, $40 a night in Wichita. I'm not sure if that's something that actually exists in the Chicago area. And then we have the infographics. So this one's under Cook County, Illinois infographics. It's down at the census tract level. But you can click on an area, like if you were going to do outreach to a specific area, you can click view. Or if this is how you wanted to look at your OFR, social determinants of health, you could enter in an address using the search bar and then combine this infographic and do a view of the infographic in that area instead. So this is the area. You can pull up a crime index where 100 is the US average. Anything above that's above the national average. So you can see crime rates for assault about 6 times higher than national average, murder rate about 13 times higher. You can also look at age dispersion. So you can see that this population is much younger compared to the rest of Cook County. You can look at employment types. Health support is much higher than average. Certain facilities will pop up here, specifically gas stations, apartments, lodging facilities, shelters, anything that we found in specifically Kansas, but other locations as well, to be a high overdose risk area. And then poverty and then SNAP utilization rates. The SNAP was more for Kansas as well, because we have very strict SNAP laws. If you have more than one drug charge, you're banned for life from SNAP benefits. So some states have similar SNAP laws as far as drug charges go. And then, yeah, you have your race, ethnicity, and then household income. So you can use this for the contextual environment. We'll typically use it for our OFRs. We'll look at the month before, the month after, 2 weeks before, 2 weeks after the overdose fatality, and we'll look at the area and the county as a whole. One, we're looking, was there a spike during the time of the overdose death or near the time of the overdose death? Is the individual near a cluster of hotspots or in a high density overdose area? What facilities are nearby? And so then I'll take you to the other tool that isn't in ODMAP, but it's part of what I've developed. And if I'm running over on time, don't feel free to cut me off, Kate. But here's a list of resources. This is base resources out of Data Axle. We work on verifying this with certain communities. I've been working with a couple communities in Washington. We've done it for ours in Reno County and Hutchinson, Kansas. There's some other optional layers here. These can also be added into ODMAP. The schools, law enforcement structures, frequent mental health distress. If you enter in an address, you can get down into the weeds a little bit. I'm just going to drop a pin somewhere. So here's a 5-mile radius, and now we can look at what resources were close by. We can get some information. We can export this as a CSV file, and we can look at substance use resources. So all this is looking at, what are the closest resources to this person's neighborhood or this individual's home or where they were living. I'm going to clear that and then drop a pin relatively in the same area. And then you can do walk time, drive time, or rings. I'm going to do walk time at 15, 20, and 25 minutes. And now we kind of get this walking area. So we can see there's some FQHCs within this area, community, family, wellness. And I can run an infographic based on the walk time. And the first infographic that'll pop up is 15 minutes if it wants to load. This one was more developed specifically for the OFRs. Get there eventually. But yeah, you can create your own layers. This tool as well, you can also add additional layers or tools. You can do some basic analysis in it if you have an ArcGIS account. And hopefully this will just pop up relatively shortly.
We do have a question in the chat if you would not mind answering it real quick while we're waiting. James Schwartz wants to know, does the API allow a direct port of the data entered into NEMSIS as it is entered by EMS, or does the tech have to start ODMAP to read the NEMSIS data after it's entered?
I guess my first question is, what is NEMSIS?
That is it's the EMS data portal.
Perfect. Okay. So the way that the API works in Chicago is they use ImageTrend as their electronic patient care reporting system, their EPCR. So when a Chicago paramedic or a company does a run and they go to fill out their EPCR, once they click that it's an overdose, the API in the background pulls out all the information that it needs, submits it into ImageTrend, that's where it runs. What we're looking to do, all the data that goes into IDPH would be being reported in through Biospatial. And Biospatial, the player on the national level, and the last couple states that they've worked with, when they go to set up an API, they do not even need to do a beta test site anymore. They will literally flip the switch that day and get it going. DJ in Kansas, do you guys have Biospatial? Do you have an API between your Department of Public Health and ODMAP?
Yeah, we use Biospatial, and it's direct from EMS into ODMAP, the Kansas Board of EMS.
Okay, so then
it's about
what
a
does
4
that
to
do
6
then with
hour delay.
NEMSIS? And DJ, what would that do with NEMSIS for the question that the person had before me?
So, I mean, NEMSIS has its own dashboard, and that same data is going to NEMSIS. It's just visualized differently. I'm not sure um, if we're talking about direct from like NEMSIS into ODMAP instead of directly from EMS, but those are two different APIs as far as I know, if I'm understanding correctly.
Alrighty then.
All right, so it took forever, but it's up now. So you'll see some of the same indicators. We have education, crime rate still. We added no health insurance. We also added struggling with healthcare costs, percent of income spent on mortgage and rent, and you can switch comparison between county and state. Language access, so Spanish speaking specifically, age pyramids again. We also used internet access as a means of does people have access to a resource that can tell them where facilities are, or resources are. Civic engagement was another one. People being able to advocate for themselves or participate in a process, feel more connected to neighborhoods, feel more resilient. And then this last one, which would be very important for this area, is no transportation. So renter households, over half of them don't have access to a vehicle. And then it looks like almost about a fifth or a little more than a fifth of owner households. So that's when this walk time would become more important, or access to public transit would become more important, how far or how long an individual would have to go to get specific resources. This is also something, we can set up for specific counties. You can add certain things yourself, like if you have distribution of naloxone, you can add that into the map, or if you have specific treatment providers, you can also add that into the map one by one. I can bulk import it or anything like that. So that's essentially what I have for you today. Hopefully that all makes sense, but I'll stick around as well for the last half of this to answer questions.
Great, thank you. So how are we using this? So we're really excited. We started a pilot project for Kankakee County with the goal of developing trauma-informed recovery-oriented systems of care through elevating persons with lived and living experience to respond to mental health needs in their community. So what they've done is they've developed block captains, or people from that neighborhood. Everybody knows and trusts them. And then there's street outreach workers. So if there is an overdose or if there's a shooting, the block captains can notify the street outreach workers, and then they can do a pop-up event there and then just wrap around the community with support. And then they'll have community navigators who are there also to help people navigate the system of care. As you know, it can be so difficult with so many different forms, gaps, and duplications. So someone to just help hold their hand to help them get care. And we're starting to, have these conversations about how do we elevate these people with lived and living experience to help tell their community story and guide data-driven decisions based on the social determinants of health overlay data that DJ has done such an excellent job of helping us to be able to launch and share in our community. So we're thrilled also to invite you to our Illinois Prevention Summit coming up November 25th, less than 30 days away. And the purpose of this is to share statewide prevention strategies and address overdose trauma and mental health needs in Illinois. So we'd invite you. This is almost sold out very quickly. We only have about 20 seats left. So I would encourage you to register today if possible. You can see the link to the QR code is there. And we'll send out this slide deck after the presentation as well. And this is our contact information if you have any questions after this. And if not, I'll put it back onto the slide with the QR code for if you want support for any of these initiatives, and just open it up for questions or pass it back to Indira if you just have any OFR in general related questions. Thank you so much for your time.
Hey, if anybody has any questions about what we just discussed, feel free to ask. Otherwise, we'll move on to like any updates or other questions related to OFR. I did have a quick question for DuPage County. Do you have a date set for your next OFR team meeting?
Hi, Angier. I don't know if Scott's able to answer that question right now, but we do have one set we're planning to meet before the end of the year, so we can send that to the group if that's helpful.
Oh, that'd be great. Thank you. Yeah, DuPage County meets virtually, so if anybody's interested in maybe observing an OFR meeting in action, they've been really kind in letting people sit in and observe. Were there any questions? Oh, go ahead, Tracy.
I was wondering with the pilot you're doing in Kankakee, what training did you do for the Black captains, the street outreach workers, and then the community navigators? Did you have specific trainings that were used for them?
So we launched a pilot group of community advisors, and they're all people with lived and living experience to hear from them of what they feel would be most important for training and equipping. And they're using from We Are Healing Together. It's called Emotional First Aid. And then they also have they're really working together with so many of our organizations in our Project Sun network, which is strengthening and unifying our network, which is really just trying to develop a stronger system of care. So they're just continually giving them more and more trainings. This is just in the planning year with this is a NACHO grant. So we're excited for the next 3 years of implementation and then the 5th year of expansion. So in the first year, they're just starting with emotional first aid, and then they'll continually do more trainings to help equip them.
Okay, thanks.
Were there any other questions, especially like our newcomers from UIC, Egyptian County? Okay. Is there any updates from Vermilion County and Kane County on how your OFR efforts are going?
Well, I can say for King County, we just posted a position for our overdose fatality review program manager. So we're beginning to get applicants. And then once we get that position hired, then we'll begin kind of building from there. So
That's wonderful. Congratulations.
thanks.
In Vermilion County, we're still working on outreach to collaborators and community partners through the health department.
Wonderful. Thanks, Jane. Okay. Does anybody else have any other questions or updates they'd like to share? Then I don't want to waste anybody's time, so feel free to hop off if you're good to go. And thank you very much for joining us today. And thank you to our speakers for taking the time to discuss this very important topic. I know I learned a lot. So thank you for sharing all that information.
Hey, Indira.
Yeah, sure. Scott.
I just remembered something. There is an OFR national forum that is occurring in February next year, and we weren't able to go in 2024, but did attend. A couple of us went in 2023, and it was really worthwhile. I mean, I've been to a couple conferences that I went to, and afterwards, if you forced me to tell you what we learned, the list would be short. But attending in 2023, it was really, really fantastic, and we viewed the resources and presentations they posted from 2024. And so I just wanted to mention that if anyone is available and has the registration is free. It's going to be in Portland, Oregon, but we found it to be worthwhile in the past. So just something to consider.
Thank you for bringing that up. I'm actually attending in February. It's February 11th and 12th. And yeah, as he said, the registration is free. You just have to pay for travel and lodging. But I'll send out the registration link along with the follow-up email. But thank you for bringing that up, Scott. Great point. Okay. All right, with that, I think we can probably close up the meeting. Thank you, everybody. Hope you have a great day.
Thank you very much, Indira. Everybody have a good day.
Thanks, everybody.
Thanks, Vic. Bye, Kate.
Bye all. Thank you.